Welcome back to The Explainer. I am so glad you're here today because we're looking at something, honestly, pretty fascinating. I want you to think of your own body as this complex, microscopic crime scene. When something is wrong, it doesn't always just set off a blaring alarm right away. Instead, it leaves these really subtle clues, subtle warning signs that something is missing. So today, we're investigating the hidden signs of vitamin and mineral deficiencies and decoding exactly what your body is trying to tell you.
Let me ask you right off the bat. Have you ever just felt unusually tired, no matter how much you sleep? Or, maybe you've noticed more hair shedding in the shower lately, or you've developed these really stubborn, frequent muscle cramps? Most of us just brush these off as everyday ailments, don't we?
Okay, let's dive into this. When these symptoms pop up, most of us immediately blame stress, poor sleep, or just having a busy lifestyle. But what if the real culprit is actually a hidden vitamin or mineral deficiency? The tricky part here is that your body starts dropping these subtle little warning signs long before deficiency becomes severe.
All right, let's move into our first investigation zone. Clue Group 1, energy and muscles.
So, if you're dealing with constant fatigue, and by that I mean you are consistently exhausted despite actually getting enough sleep, we have a lineup of usual suspects. We're looking at iron, vitamin B12, folate, and vitamin D. Now, these aren't just arbitrary letters and minerals. They are absolutely essential for normal red blood cell production and keeping your nervous system functioning exactly like it should. Let's think about hemoglobin for a second. It's a vital protein in your red blood cells, and it completely relies on iron to do its job. And that job is carrying oxygen throughout your entire body. So when your body doesn't have enough iron to produce adequate hemoglobin, your cells are literally not getting the oxygen they need. I mean, no wonder you feel exhausted, right? It's a perfect example of how much we rely on these specific minerals.
But what if your energy is totally fine, but your muscles are acting up? Well, if you're dealing with recurrent cramps or twitching, our suspects shift over to magnesium, calcium, and potassium. These minerals are vital because they actually help your nerves communicate with your muscles, which allows for normal muscle contraction. And we definitely have to highlight vitamin D here too. It plays a huge role in calcium absorption, and when your levels drop really low, it directly ties to bone pain and muscle weakness, particularly for folks who might not get much sunlight.
But whoa, before you run to the medicine cabinet, watch out for the red herring. Fatigue or muscle cramps do not automatically mean you need a supplement. Sudden cramps can just happen after intense exercise, or simply from being dehydrated. And fatigue? Well, it has a massive list of possible causes: poor sleep, stress, infections, even thyroid problems. These physical clues just tell us to pay attention. They are definitely not an automatic diagnosis.
Moving right along to Clue Group 2, the head and face.
Let's look at the clues hiding in plain sight. Finding more hair on your pillow can sometimes point back to iron. Persistent cracks at the corners of your mouth? Those might be tied to B vitamins. And bleeding gums? That is a classic sign of vitamin C deficiency, literally the exact same issue that caused scurvy and pirates centuries ago. Now, while that's rare today if you eat a varied diet, it's for sure still a suspect on our board.
You know, what's fascinating is how we typically behave when we see these signs. If you get those really annoying cracks at the corners of your mouth, the immediate instinct is to just aggressively apply lip balm and hope it disappears, right? We just try to cover up the symptom. But if it keeps coming back, I want to challenge you to look a little deeper. Irritation or saliva buildup could cause it, sure, but so could a genuine nutritional gap. Let's consider another visible clue: your eyes. Vitamin A is absolutely essential for normal vision, and a severe deficiency can interfere with seeing in low light. But again, beware the red herring here. Many eye conditions have absolutely nothing to do with a vitamin deficiency. Please don't assume every change in your vision means you need more vitamin A. In fact, as we'll see shortly, taking excessive amounts of vitamin A can be downright dangerous. Okay, here's a symptom most people completely ignore: changes in your tongue. If your tongue becomes sore, unusually smooth, or swollen, it's actually a major clue. And it ties right back to our recurring suspect, nutrients: vitamin B12, folate, and iron. Again, a sore tongue could just be irritation from something you ate, but it is also the body's way of telling you that something might deserve your attention.
And that brings us to our final physical investigation zone, Clue Group 3, skin and extremities.
Have you noticed your skin looking unusually pale compared to your normal appearance? This brings us right back to iron deficiency anemia. Remember how we talked about hemoglobin? When red blood cells carry less oxygen, it can lead directly to paleness, dizziness, and even shortness of breath. And what about your hands and feet? If you get persistent or unexplained tingling, numbness, or that weird burning pins and needles sensation, the primary nutritional suspect is a vitamin B12 deficiency.
So the crucial point is this. B12 is foundational for normal nerve function. If you are experiencing persistent numbness, you simply cannot ignore it. Identifying a B12 deficiency early matters greatly to prevent prolonged neurological problems. The stakes for your nerve function are incredibly high here.
Which leads us to our next point, the plot twist, the self-diagnosis trap.
So we've gathered all these clues, and you might be ready to run out and buy a cart full of supplements right now. But hold on, because here is the ultimate climax of our investigation. You can have symptoms that look exactly like a deficiency, but are actually caused by something completely different. Hair loss, for example, is incredibly complicated. It could be genetics, stress, or thyroid disorders. Bleeding gums are much more commonly caused by gum disease, not a lack of vitamin C. Blindly treating these clues with random supplements is a dangerous trap because the symptom itself doesn't tell you exactly what's wrong.
And here is the harsh medical reality straight from our source material. Taking excessive amounts of certain vitamins can actually cause harmful effects. We mentioned earlier that too much vitamin A can be dangerous. Taking iron supplements when you don't actually have an iron deficiency? Also not a good idea, because too much iron in the body is really harmful. Bottom line, excessive self-supplementation is physically risky.
The resolution, finding the root cause. Let's talk about how to actually move forward.
The absolute best way to defend against these mysteries is the foundation, a varied diet containing vegetables, fruits, whole grains, legumes, nuts, seeds, and appropriate sources of protein and healthy fats. Yes, obviously your specific needs depend on your age, your lifestyle, and any medications you might be taking, but a foundational, varied diet prevents so many of these deficiencies from ever even starting.
If you are experiencing persistent clues, don't guess. Let's move to our protocol and see how this builds logically. Step 1, identify the symptom. Just note what's happening. Step 2, consider the possible causes, knowing full well it might not even be a vitamin issue. Step 3, discuss it with a healthcare professional. And Step 4, use blood tests or other investigations when medically indicated. This is literally the only reliable way to determine your true vitamin status.
Ultimately, the goal isn't to just take as many vitamins as humanly possible, it's to give your body exactly what it actually needs. That is the core philosophy here. We're listening to the body, not overwhelming it.
I want to leave you with this provocative thought as we wrap up. Look at your own habits. When your body leaves a clue, whether that's fatigue, random cramps, or a persistently cracked lip, are you just treating the symptom, or are you actually finding the cause? Because the earlier you uncover the real underlying issue, the easier it will be to truly address it. Thank you so much for joining me on this explainer. Stay curious, keep paying attention to those clues, and I'll see you next time.